Welcome to the deep dive. We're taking essential info and really digging into it.
That's the plan.
And today, this one's really for you, our nursing students heading into pediatrics.
Yeah, focusing specifically on those core skills.
Exactly. We're pulling from Wong's Nursing Care of Infants and Children, Chapter 22, the 11th edition notes on pediatric interventions and skills.
It's a foundational chapter, really covers a lot of ground.
Our mission today, to pull out the absolute must-knows for taking great care of kids. Make it clear, make it stick.
And hopefully, engaging too. Give you that solid base for practice.
Because understanding why we do things is just as crucial, right?
Absolutely.
Yeah.
Especially with kids. So we'll be hitting those key principles underpinning everything.
Okay, let's get right into it then. The chapter, it starts with these big foundational ideas. First one, family-centered care.
Right.
And it sounds, straightforward, but what are the nuances nurses really need to get?
That's a really good question. Because it's more than just like including the family. It's truly seeing them as the constant, the expert on their child.
Ah.
It means actively partnering, respecting their input, making them part of the team.
So real collaboration.
Exactly. And sometimes that means, navigating disagreements or supporting families under immense stress. Needs good communication, real empathy.
Makes sense. Not just being polite, but genuinely working together.
Okay, next concept. Developmentally appropriate preparation. We've touched on this before, but why is it so critical?
Well, think about it. A toddler versus a teenager. Their understanding, their coping mechanisms are worlds apart.
Right.
So knowing basic developmental stages like a preschooler has no real concept of later, a teen needs autonomy that directly tells you how to talk to them, how to prep them.
Can you give an example?
Sure. For, say, a preschooler, you wouldn't give a long technical explanation. You'd use simple words, maybe let them handle some safe equipment on a doll first.
It's like playing with a stethoscope? Exactly.
Right.
Reduces fear, builds trust. For a school-ager, maybe a simple diagram. For a teen, more detail, respecting their privacy. It's all about tailoring it.
Right, meeting them where they are. And the third one, atraumatic care. We know it means minimizing distress, but what's the bigger picture?
The bigger picture is potentially long-term. If we consistently minimize pain, fear, separation, it can shape their whole view of healthcare, make them more willing to seek help later in life.
Oh, interesting. So bad experiences can really stick.
They really can.
Yeah.
Fear, avoidance. So atraumatic care isn't just about the now, it's an investment in their future health relationship.
Wow. Okay, so those three really frame everything. Now, building on that, informed consent, parents give that, obviously. But the chapter talks about assent from the child. What's the difference and why does it matter?
Assent is about respecting the child's growing autonomy. Legally, parents consent, but asking a child who can understand even partially for their agreement, their assent, it shows respect, it involves them, gives them a voice, even if they don't have the final legal say, helps them cooperate, feel less powerless.
So it's like acknowledging their feelings about it.
Precisely.
Yeah.
And as a dialogue, you adapt it to their understanding.
Okay, that clarifies the distinction. Now, prepping for actual procedures, age-specific methods again. Beyond just knowing the stages, any practical tips for applying this on a busy unit?
Yeah, it helps to have like a mental toolkit for infants. Maybe just soothing sounds, distraction.
Okay.
Toddlers, like we said, picture books, dolls. School-age kids often like diagrams, asking questions. Teens need info, rationale, privacy.
And offering choices.
Huge, even small ones, which aren't for the blood pressure cuff. Gives them a bit of control.
That makes sense. The chapter also pushes for simple, honest language. Why is that so vital, even if you think they won't fully get it?
Kids are smart, They pick up on things. If they sense you're hiding something or sugarcoating too much, it breaks trust. Simple, honest words, even if they don't grasp every detail, feel safer. And avoid confusing euphemisms. Don't say it won't hurt, if it might. Say a quick poke, or it might feel like pressure.
Honesty builds trust.
Got it.
Got it. Okay, let's switch gears to surgical procedures. Pre-op teaching is so important for kids and parents. What are the absolute essentials nursing students need to cover?
Right, pre-op. Got to cover MPO status, nothing by mouth and why. Super important.
Explain the reason, not just the rule.
Exactly. Then anesthesia, what to expect, how they'll fall asleep, where they'll wake up, reduces that fear of the unknown.
Okay.
And also the immediate post-op period. Pain management is key here, letting them know how their pain will be handled.
And the chapter mentions prepping families for tubes, drains, monitors. That sounds scary for parents. How do you approach that?
Gently, with empathy. Acknowledge it looks frightening.
Yeah.
Explain the purpose of each thing simply. Maybe show pictures beforehand if possible. Reassure them it's temporary, it's helping.
And parental presence.
Definitely discuss that. If hospital policy allows parents during induction of anesthesia, it could be a huge comfort for everyone.
Okay, good points. Let's shift to more basic care. Hygiene and skin. Kids' skin is more fragile.
Much more fragile, so careful hygiene is key. Gentle bathing, proper cleansers.
Oral care, too.
Yes, even for infants. Prevents issues. Pay attention to skin folds, for diaper dermatitis, frequent changes, barrier creams, zinc oxide, petrolatum.
And preventing pressure ulcers.
Critical for immobile kids. Repositioning every 2 hours, minimum. Good padding, keeps skin clean and dry. It's all about vigilance.
Makes sense. Moving to nutrition. Feeding a sick child can be tough. Any strategies when their appetite is just gone?
Oh yeah, that's common. Patience is key. Small, frequent meals work better than big ones.
Like grazing.
Sort of. Offer appealing foods. Consider their preferences and aversions. Make it look nice. Calm environment helps too. Sometimes involving them in prep, if they're old enough.
Okay. Now, the chapter details gavage feeding NG or OG tubes and gastrostomy feeding. Can you hit the key nursing points for each?
Sure. Gavage feeding always. Always. Check tube placement first. Aspirate contents, check pH.
Every time.
Every single time before feeding. Head a bed of 30 degrees at least during and after feeding. Reduces aspiration risk. Monitor residuals too, see how they're tolerating it.
And gastrostomy tubes. G-tubes.
G-tubes, meticulous skincare around that stoma site is vital. Prevent infection, breakdown, secure the tube, make sure the formula and rate are correct. And for both types, parent education is huge for home care.
Right. Temperature management. Fevers are common. When do we actually treat a fever in kids, and how?
Good question. Remember, fever itself isn't usually the enemy, it's the body fighting something.
So don't jump on every slight rise?
Generally, no. Treat if the child is clearly uncomfortable, fussy, distressed. Antipyretics, acetaminophen, ibuprofen based on weight. Always weight-based dosing.
Okay.
Tepid sponge baths can help, but never cold water or alcohol. Light clothes, lots of fluids. And crucially, find the cause of the fever.
Always look for the underlying reason. Got it. Safety huge in PEDS. What are some easily missed hazards in a hospital room?
Things like IV poles that could tip, cords dangling, unsecured equipment. Kids are curious.
Sure.
Crib safety side rails up. No small loose items inside. Choking hazards. Watch out for accessible cleaning supplies, sharps containers not secured. And fall precautions, tailored to age and mobility.
And related to safety infection control, hand hygiene is #1.
Absolutely #1. Kids, especially little ones, have immature immune systems. Frequent, thorough hand washing by everyone, staff, family, visitors, is the single best prevention.
Simple but effective.
Totally. Plus, understanding and using the right isolation precautions, contact, droplet, airborne, and cleaning toys. Shared equipment needs regular disinfection.
Okay. Transporting kids around the hospital needs specific methods, right?
Definitely. Age and condition appropriate. Infants in cribs, maybe wagons if secured. Older kids, wheelchairs with safety belts.
And equipped.
Secure any IV pumps, oxygen tanks, monitors to the transport device. Check everything before you move.
Yeah.
And never, ever leave them alone during transport.
Right. Restraints. The chapter says therapeutic holding first.
Always first. Gentle but firm hold for security during a procedure.
But sometimes physical restraints are needed. When and what are the rules?
Only when safety is at immediate risk, like pulling out lines or they're interfering with essential treatment, and after trying less restrictive things,
Okay.
you absolutely need a provider's order. Specifies type, duration, and the nursing responsibility is huge. Document why, what type, when applied. Check circulation, skin, comfort regularly. Remove them ASAP.
Lots of checks and balances. Moving to specimen collection. Goal is atraumatic, right?
How? Be gentle, efficient.
Yeah.
For urine, explain clean catch clearly to older kids. Use collection bags properly for infants.
Blood draws needles are scary.
Yeah. Use smaller needles if possible. Numbing cream beforehand helps a lot. Distraction is key bubbles, videos, singing. For heel sticks on babies, warm the heel first. Your calm approach makes a huge difference.
Okay. Medication admin. So critical. Weight-based dosing is everything.
Everything. Calculate carefully. Double check. Verify safe dose ranges from a reliable pediatric source. Many places require a second nurse check, too.
The rights still apply.
Absolutely. Right. Patient, drug, dose, route, time, documentation. The fundamentals are even more critical here.
And specific routes. Anything unique for kids.
Loads. Oral meds, often liquid, use an oral syringe for accuracy. Don't mix in a full bottle, they might not finish.
Right.
IM injections, vastus lateralis muscle in the thigh for infants. It's safer. For EVs, always use a pump. Watch closely for infiltration. Phlebitis, small veins are tricky.
Rectal, inhaled.
Rectal ensure retention. Inhaled, use spacers with MDIs for better delivery, especially for younger kids. Masks for nebulizers. Proper technique is key for all rounds.
Pain control. The chapter mentions a multimodal approach. What does that mean in practice?
It means using a mix. Pain meds, analgesics, opioids when needed, plus non-drug methods.
Like what kind of non-drug methods?
Oh, distraction games, music, guided imagery, relaxation breathing, positioning, swaddling infants, heat or cold packs. The key is using an age-appropriate pain scale to assess first, then tailor the interventions.
Makes sense. Freight therapy is common. What do nurses need to watch for with kids' IVs?
Fluid balance is critical. They dehydrate faster.
Yeah.
So pumps for accuracy are essential. Frequent site checks are non-negotiable. Infiltration, phlebitis, infection signs.
And securing the line.
Yes, kids move. Secure it well to prevent accidental removal. With central lines, it's all about strict sterile technique for dressing changes, accessing the line to prevent those serious bloodstream infections. Clean cuz eyes.
Home Fori care needs teaching, too.
Definitely. Families need to know signs of trouble if they're managing a line at home.
Okay. And TPN, total parenteral nutrition. For kids who can't eat enough, what are the big risks?
TPN goes through a central line, so infection risk is high. Strict sterile technique again. Monitor blood sugar closely. Highs and lows are common. Watch fluid and electrolytes. Look for any adverse reactions.
Lots to monitor. Okay, nearly there. Elimination procedures, enemas, and ostomies. Key points.
Enemas use the right volume for the child's age. Proper positioning. Ostomy, skin care around the stoma is paramount. Prevent irritation.
And teaching?
Crucial. Teach the family and the child, if they're old enough, how to manage the pouch, what the stoma should look like, signs of problems. Involving the child promotes acceptance.
Absolutely. Finally, wrapping it all up, family education and discharge planning. This starts early, right?
From admission, ideally, it's ongoing. Instructions need to be clear, written, and verbal, tailored to them.
What absolutely needs to be covered?
Med's name, dose, route, schedule, side effects, any treatments, wound care, feeding methods, diet, activity limits, crucially when to call for help, what signs mean trouble.
And return demonstration.
Yes. Have them show you they can do it, give meds, change a dressing, builds their confidence, provide contact info, follow-up plans, support resources.
Wow, that was a really comprehensive run-through of these essential skills. It's clear how much goes into great pediatric nursing.
It really is. Understanding these principles, mastering these skills, it's the foundation for providing safe, effective, compassionate care.
So as you, our listeners, reflect on all this, think about the breadth of skills we covered. Here's your point to ponder. Reflecting on these essential skills, what specific area do you feel most motivated to explore further in your clinical practice?
It's a great question to carry forward.
Definitely food for thought as you continue your nursing journey. Thanks for joining us for this deep dive. Keep learning, keep questioning, and strive for the best care for kids and families.